Hey y'all, this is Kosta. I help people break the system to build a better future. Today we're talking about what's the best choice, facility-based care or in-home care. I'm not gonna sugarcoat it because you already know the healthcare system in the United States is confusing, and that's an understatement, especially when it comes to long-term care. So making the decision to move forward with either facility-based care or at-home care for you or a loved one can take years of planning and research, both personally and financially. My best advice before we get into the specifics of this video is prepare yourself for the inevitable event of needing long-term care. Like so many decisions we'd rather not make, it's easy to push this off to another day. But the longer you wait, the less options you'll have, and losing control when it comes to your care is not a position that you want to be in. My first step is assessing the necessary needs of yourself or the individual you're caring for. Will they need 24-hour care? Will they be able to care for themselves in any capacity? Are their care needs cognitive or physical? How long will these services be needed? Do they have a space that will accommodate this transition and mobility level? There are hundreds of questions to ask when deciding between long-term care options, but one of the most important and often overlooked questions is what brings this individual the most comfort and happiness? Speak up, be your own advocate, and if you're representing a loved one during this transition, listen to their requests and concerns. Do your homework. With workforce shortages and increased demand, waiting lists for facility-based care and in-home care can take months to years. Often applicants will be asked to make a decision about an available bed within 24 hours of their notification. If you need care immediately, my best advice is to consider a combination of family support and paid in-home care services. Not only will this be more cost-effective, it will help the individual transition into their new routine with familiarity. Unfortunately, no long-term care answer is black and white. I can't tell you what option will best serve yourself or your family, but what I can tell you is facility-based care should be your last option. Finding a way to age and receive care in place is the most likely path to a happier, healthier, and more sustainable life. People weren't meant to exist warehoused in communal living with hundreds of other frail and dying individuals. Imagine how that would make you feel. Imagine how that would affect your mental and your physical health. Of course, there are situations where facility-based care is the best option, but it should be the last resort. For example, when a disease has progressed to the point of 24/7 care with professional medical support being necessary, or when mobility is so limited that moving without assistance just is not possible. I hope that this has helped answer a few questions about facility-based care and at-home care, and if you have any questions, please leave them in the comment section below.